In this video, I'm going to show you how to fix one-sided hip pain for good. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. So when it comes to one-sided hip pain, a major cause is due to a blend of weakness and tightness in the muscles that support this area, notably the glutes or the buttocks. To make getting relief really easy, I broke the video up into two separate parts. In the first part, we're going to focus on getting quick relief by releasing or lengthening these tight muscles. In the second part, we're going to focus on getting rid of it for good by strengthening the hip muscles for long-lasting relief. While each part is different, they are meant to work together. My best advice, go through all the exercises and use what gives you the most relief. With that being said, let's get started. Let's get some quick relief by doing some hip muscle releases. This first one we can do in bed or on a floor. Just lie flat on your back like this. What you want to do is put your feet together and then just gently press your heels down into the floor until you feel a light activation in the muscles around the hip. This would include the glutes or the buttocks. From there, you're going to take your knees and press them downward as much as you can until you feel a really good stretch forming on the inner part of your thigh that works towards the groin into the hips. Once you feel it in the hips, you want to hold this comfortably for a second or two, and then what you're going to do is then bring your knees together. And then from there, you're going to go down and up like this, kind of like a butterfly flapping its wings. I like to do this in both directions about 20 times, and with each repetition, I just challenge myself to go down a little bit more. So afterwards, see how you feel. If it's really helping out, but there's a little bit more tightness left, you're more than welcome to throw in as many repetitions as you like. But let's take this one to the next level and focus on some more movements that are going to target different muscles. One I really like to do is called the windshield wiper. For this one, we're going to have our legs roughly hip width apart, knees bent, feet flat. We're going to take our heels and just lightly press them downward into the bed or the floor until we feel that light activation into our glutes. From here, we're going to keep our back as flat as possible and then swing our knees towards one side, moving through our hips. You're going to feel a really good stretch form on the outer part of your hips. Once you feel that, hold this for a second or two, and then just like a windshield wiper, you're going to swing towards the other side and repeat. Do this nice and slowly for 20 times in both directions. With each repetition, just keep building into it more and more. So at this point, you should definitely start to feel some warmth coming into the area, especially around that hip. That's blood flow that we're looking for. So now let's focus a little bit more on that painful side. So let's say it's my left hip that's bugging me the most. What I'm going to do is keep that knee bent while the other leg goes straight like this. Let's lift that knee upward towards the ceiling, keep it at 90 degrees, take the hand on the other side, hook right on the outside of that bent knee. Now pull that knee across your body, moving through your pelvis and hips as much as you can. You're going to feel a deep stretch form on the outer part of your thigh, working into the hips, into the lower back. I really concentrate that stretch over the hip until I finally feel it in my lower back. And at that point, I hold this for 20 to 30 seconds. Release it and then repeat this 3 to 5 times. And with each repetition, try to build into it just a little bit more. And for good measure, even if the other side doesn't hurt, I would throw a couple repetitions in on that side just to help keep everything in balance. Here's another really good muscle release that we can do seated, so it's perfect to do anytime, including at work. Whatever side that you're having hip pain, let's say it's your right side, you're going to take that side's ankle and place over your other side's knee. So when you look down, it should look like a figure 4. If you have a lot of difficulty getting into this position, to make it a little bit easier, straighten this other side like this, put your ankle over the other side's shin. That way you can grab in front of the shin or on your pant leg and slide it into position. So the first thing that we want to do is just focus on stretching these tight, achy muscles, including the buttocks. We're going to cup around our knee with our hands and now pull this knee across our body towards our other side shoulder. So my right knee is going towards my left shoulder. As you do this, you're going to feel a really good stretch form on the outer part of your thigh that works into your hip. Once you feel it into the hip, you want to hold this for 20 to 30 seconds, release it, and then repeat this 3 to 5 times. And with each repetition, just try to build into it a little bit more. So at this point, things should start to loosen up, and you're also going to get some blood flow in. So let's focus on getting a much deeper activation into these muscles. So what you're going to do with this bent knee this time around is press it down towards the floor, but don't use your hands. Instead, use your leg and hip strength. The more that you press down, the more that you're going to feel a deep activation into the hip. Hold this comfortably for 5 seconds. You're going to release it, and then you're going to repeat this 5 to 10 times. Again, with each repetition, just build into it a little bit more. Afterwards, see how you feel. If it feels like you have a little bit more energy, try to throw in another set or two. But if you would like to take this one to the next level and focus on some more muscles, including into the lower back, let's do this. So let's take this bent knee. We're going to press it down until we feel that really good activation. But this time around, I'm just going to keep my back straight, and then I'm going to lean forward, lowering my chest towards the floor. Do this one slowly because you're going to feel a really deep stretch into the hip, working into your back. Once you feel that, hold this for 5 seconds, release it, repeat that 5 to 10 times. You can also do a side leaning stretch. This one is really good if you have lower back and hip pain off to one side. So let's take that bent knee, press it downward until we feel it into the hip. We're going to hold that and now just have our back nice and straight. We're just going to lean towards the other side until we feel a really good opening stretch from the bottom of our ribs into our lower back and then finally into the hip. Once we feel that, 5-second hold, we're going to release it and then repeat this 5 to 10 times. With all of these movements, you may find that one is just targeting that muscle tightness the most. At that point, I would keep building into that movement over and over again until everything is nice and loose or you're not getting any more improvement. Just remember though, whatever you do on one side, always do on the other to help keep everything in balance. So now let's turn our attention towards getting long-lasting relief by doing some really good hip strengthening exercises. This first one we can do in bed or on a floor. Just lie on your side with the painful side towards the ceiling and support your head with your hand just like this. So the first movement is called the clamshell. We're going to have our knees bent roughly at 90 degrees and we're going to put our feet together. Now with this painful side's knee, the top knee, you're just going to swing it backward as much as you can until you feel a really good activation into the muscles around the hip, including the glutes. You want to hold this comfortably for about 5 seconds, release it, and then lower your knee back downward. And just repeat this about 10 to 15 times. With each repetition, build into it just a little bit more. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or two. For most people though, this is going to be pretty easy. So to make it a little bit more challenging, what we can do is straighten our legs like this and have our body in a nice straight line. With this top painful side's leg, what we're going to do is slowly raise our foot upward towards the ceiling. This time around, you're going to notice a really deep activation into the glutes and the buttocks. Hold this comfortably for 5 seconds, release it, and then repeat this 10 to 15 times. But again, if it feels like you have a little bit more energy, challenge yourself by throwing in another set or two. The really good thing about this position though is we can take it to the next level and also focus on strengthening the muscles that help with hip rotation, that is turning the leg inward and outward. So let's focus on internal hip rotation. This time around, instead of keeping my foot parallel with the floor, I'm going to turn it inward as much as I can until I feel a really good activation into the hip. Once I feel that, I'm just going to slowly raise that foot upward towards the ceiling. This one's generally a little bit harder and you're going to feel the muscles get hit a little bit differently. So again, hold that for about 5 seconds and then release it. On the next repetition, we're going to go in the opposite direction, focus on external rotation of the hip. So this time around, we're going to turn our foot outward as much as we can until we feel it in the hip and then raise our foot upward. I would go through all 3 of these movements. You're probably going to find that one just feels the weakest or there's a lot of achiness with it. At that point, treat it like your weak link and throw in more repetitions in that position to make sure you get a really good workout. Just remember though, whatever you do on one side, always do on the other to help keep everything in balance. Here's another really good hip strengthening exercise I call hip clocks. The great part is we can do this when standing, and also we're going to need is something sturdy enough that will support our body weight that's roughly hip level. So a chair, desk, countertop should work. To get into position, you're going to have your body nice and straight. Just have very good upright posture. You want the non-painful side's hip facing that object that you're using. So I'm going to demonstrate what to do if you have right-sided hip pain. So just like the name implies, hip clocks, we're going to imagine imagine a clock around us and we're right in the center of it. Let's start at 12 o'clock. What I'm going to do is take the painful side's leg, straighten it out in front of me, lift my foot up slightly, and then point my toes down towards the floor. So what you want to do is raise your foot upward towards the ceiling as much as you can until you feel a deep activation around the front of your thigh, targeting the hip flexor muscles, huge instigator of hip and back pain, and also around the hip. Once you feel that, hold this comfortably for about 3 to 5 seconds and then just lower your foot towards the floor. Take a breather if needed. But on the next repetition, we're going to switch it up and go a little bit more towards 12:30 and then repeat. You're going to notice it hits the muscles a little bit differently. So experiment with as many different positions on that clock. Go towards 3 o'clock, 4 o'clock, you can go all the way backward towards 6 o'clock. What you're going to notice is one position, for me it's about 2:30, it just feels like it's the most weak, achy, or tight. At that point, that's my weak link, and I want to stop in that position and throw more repetitions in. I like to do this about 5 to 10 times. But if you really want to take this one to the next level, you can also help strengthen those muscles that control hip rotation. So let's focus on internal hip rotation. Let's go back to our weak link spot. Again, for me, it's about 2:30. This time around, I'm going to turn my foot inward as much as I can until I feel a really good activation around the hip, and then I'm going to repeat. It's a lot more challenging. You can also focus on external rotation by taking your foot outward. I would go through as many different positions and also turning your foot inward and outward until you find that everything feels like I got a really good workout. Just focus on your weak links the most. And remember, whatever you do on one side, always switch to the other to help keep everything in balance. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.